anxiety, I want to talk to you today about the cause of your anxiety that likely is being missed by your doctor. So too often we in conventional medicine in the United States are very symptom oriented, and anxiety is tough because certainly a lot of things can cause it, but I'm going to talk to you today about a cause that is missed pretty universally. And it's called a hiatal hernia, but I have to describe it more for you to really understand what's happening with this phenomena. Because there's what's called a frank hiatal hernia, which actually most people don't have, and then there's this sort of subclinical version of it, meaning it's there very subtly, but it's causing dramatic symptoms, anxiety being one of them. So I'm going to give you a little list of the types of patients or the types of things that can cause this. The list is quite long. So it could be a mother who's had a baby, not even recently. There can be a passage of time. Somebody who ate a big meal, believe it or not. Somebody who works out really hard. Someone who has acid reflux or constipation. Sometimes this can be, the first time it happens is you wake up in the middle of the night and your heart is racing and you feel anxious and you have no idea why. You were asleep a moment ago. You can have a medical procedure. A patient had actually a laparoscopy. She had a gynecological procedure, but they intubated her. And after the intubation wore off, this occurred. What else I want to see? Yeah, those were all the things. I had a little list here that I'm looking at. So those are the things I wanted to mention to you. So what's the phenomena? It has to do with the fact that your nervous system is acutely aware of how much oxygen you're getting, which makes sense. I mean, imagine if somebody sort of had their hands around your neck and, you know, you were still breathing, but not quite enough, right? Certainly you can, even just thinking about it, you can get a little anxious. It's like not enough air, not enough air. The nervous system gets very upset about that, and it will let you know. Your heart might race or pound. It might skip a beat. Of course, you get this feeling of kind of doom and anxiety that comes over you. And so the way people describe it is sometimes it's very sudden, and it's not associated with a life incident typically. So it's like, well, so the first time it happened, yeah, I just woke up in the middle of the night and my heart was pounding and I felt short of breath and of course, you know, anxious because of that. I went to the emergency room and they checked my heart and they checked my lungs and they said my heart was fine and I was just having a panic attack. So very often this is kind of shoot off with you're having a panic attack and your life is stressful. But a lot of times, you know, what's natural is to find a reason for. So if all of a sudden you're feeling anxious and your heart is racing or pounding or shortness of breath or a little pressure in your chest, or you just have this feeling of like, ooh, something's not quite right, you're going to look to the outside world to say, geez, why? You know, because we feel better when there's a reason. But when I'm kind of teasing this out with patients, what comes out from them a lot of the times is, you know, this can come upon me as I'm very just quietly at my desk, you know, nothing exciting's happening and all of a sudden, there it is. And nothing occurred, nobody yelled at me, it wasn't a stressful day. So this is the kind of anxiety I'm talking about, where it just kind of comes upon you and it's not indicated by something in life. It's not like the car almost hit you or somebody just yelled at you or you suddenly got this deadline at work that you have no idea how you're going to accomplish. It's not that. It just comes on you and there wasn't this exterior kind of source. And then if it comes along with heart racing or pounding or shortness of breath, of course you're going to think my heart. What's wrong with my heart? And then if you go to the ER and they check your heart and they tell you you're fine. I have patients who come in who have repeatedly gone to the ER. Finally, their local emergency room says, okay, listen, Your heart's fine. You have to stop coming in. You need to sort of talk yourself down at this point because there's nothing more we can do. We've checked your heart. So I'm trying to give you a lot of the types of events that I see with this problem. And what's really creating it is the fact that your diaphragm, which if you see where your ribs are, the diaphragm is right there, and you have this sort of dome-like muscle on either side, and that diaphragm is what bows down when you take a deep breath and pushes back up when you exhale, and it's moving air. Okay, and it's that movement of diaphragm that allows air to come in and come out, and they call it the diaphragmatic excursion, but it's how much that diaphragm can freely move to get as much air as you want. So if you've ever breathed shallowly for any reason, if somebody is having a panic attack, or they'll say, okay, slow down your breathing. Don't be shallow, because your nervous system gets more excited if you're not getting enough air and you're shallow and you're doing a shallow breath. So it's like, and you'll see this on the movies. It's like, okay, so deep breath in, and the person's like, right? And you go, no, slow it down. So in, okay, let it out. And as soon as you slow the breathing, the heart rate slows down and the nervous system slows down. But you have to understand, because of the reason, the stomach is in spasm, it's pushing up on that diaphragm. So your diaphragm literally can't move as well as it should. So this whole cascade of events leading up to this anxiety feeling is literally coming upon you primarily because of a digestive root cause, or minimally because of a diaphragmatic, the diaphragm not moving. And most frequently that's coming upon you because of digestion. It can sometimes come upon you because a woman had a baby, and because the baby took up a lot of the abdomen, everything kind of got pushed up, and it never came back down. So the diaphragm went into a spasm, and it never got released. So sometimes young men are lifting heavy weights, and things kind of pop up, and then they don't come back down. So this problem I'm talking about, men, women, young, old, it doesn't spare anyone. So it's not something we only see in a certain sex. It's not something we only see at a certain age. But I want to go over it because the problem is that these drugs that you're given for the quote-unquote panic attack, the anti-anxiety medication, the antidepressive medication, not only is it getting into your head that you have a psychological problem, which you don't have, but also these drugs have very dangerous side effects. Suicidal thoughts and tendencies being one. So this is something we see here at the clinic a lot, and we see it an awful lot. And people travel to see us from all over the country, to some degree internationally, because they're not getting the solution that they deserve. They're on these dangerous drugs, and that's not getting to the root of it, because remember, it's your nervous system registering the fact you're not getting enough air. And sure, one of the symptoms actually is occasionally you'll just take a deep breath, and because the body is not getting enough air, and you'll just sort of feel that shortness of breath, and you'll take this deep breath and you go, oh, okay, that feels a little bit better. But then you go back to life, and because that natural motion of the diaphragm isn't there, that whole panicky feeling ensues. Now you can have chronic constipation that's creating this. You can have heartburn, acid reflux. It's a very long list of symptoms. You can go to our website, rootcausemedicalclinics.com, and there's a free ebook on hiatal hernia, and you can see all the variety of symptoms associated with this. But what I really wanted to get across is that this is a very miserable symptom, and I've literally seen it ruin people's lives. People become homebound because of it. They have to quit their jobs because of this overwhelming anxiety. They're on drugs that are making them feel worse, not getting to the root cause. And the solution is very easy. And So what is the solution? Well, here at Root Cause Medical Clinic, we're all about getting to that root cause. So did you get it because you have a stomach in spasm, and it's in spasm because there's something you're eating that it doesn't like? Did you get it because you've got chronic constipation and that bearing down type of thing that you have to do, and the increased pressure in the gut has forced everything up? Did you get it because you had some sort of a medical procedure and it was a sort of a structural change that happened? When I say structural, I don't mean that it's irreversible, but your diaphragm went into spasm, and that spasm has to be sort of broken and released. I can't give you a single answer because there's not a single cause. The result is the anxiety, which we're talking about, and I'm talking about the fact that the diaphragm is not moving and getting you enough air, but that can come about for a few different reasons, and we have to find out what the reason is for you. What I can tell you is it's natural, drugs are not needed, and the team here that we have at Root Cause, we have internal medicine and functional medicine, and then we also have a physical medicine side of the team, which is chiropractic and physical therapy. And most often there's a dietary change that has to be done, looking at the gut and the stomach and getting that balanced. And there's also a structural change because that diaphragm has spasmed up, and we need to release that spasm. So the chiropractic and physical therapy comes in as well. So it really is a combination of therapies for most people, but it doesn't take long, it's natural, and you don't have this problem anymore. So I just really wanted to share that with you, because if it's not you, I guarantee you know somebody suffering from anxiety, and it's very often not up here, but physiological, and the solution is not difficult. So please share this with someone you know who's suffering from anxiety, and we're here to help. It's something we have really great success with, and every time a patient does make it to see me, I think, oh, I got to talk about this more, because for every one of them, there's probably 10,000 that are suffering needlessly, and that we don't want. So reach out. We are happy to do a consultation over the phone if you're not local, and the number here is 408-733-0400. We'll talk to you soon.